Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. A man brings his elderly wife to the emergency department. He states that she has been vomiting and has had diarrhea for the past 2 days. She appears lethargic and is complaining of leg cramps. What should the nurse do first? Option A. Start on 4. Option B. Review the results of serum electrolytes. Option C. Offer the woman foods that are high in sodium and potassium content. Option D. Administer an antiemetic. Right answer is Option B. Review the results of serum electrolytes. Further assessment is needed to determine appropriate action. While the nurse may perform some of the interventions in options 1, 3, and 4, assessment is needed initially. Using the principles of standard precautions, the nurse would wear gloves in what nursing interventions? Option A. Providing a back massage. Option B. Feeding a client. Option C. Providing hair care. Option D. Providing oral hygiene. Right answer is Option D. Providing oral hygiene. Doing oral care requires the nurse to wear gloves. The nurse is preparing to take vital sign in an alert client admitted to the hospital with dehydration secondary to vomiting and diarrhea. What is the best method used to assess the client's temperature? Option A. Oral. Option B. Axillary. Option C. Radial. Option D. Heat-sensitive tape. Right answer is Option B. Axillary. Axilla is the most accessible body part in this situation. A nurse obtained a client's pulse and found the rate to be above normal. The nurse document these findings as Option A. Tachypnea. Option B. Hyperpyrexia. Option C. Arrhythmia. Option D. Tachycardia. Right answer is Option D. Tachycardia. Tachycardia means rapid heart rate. Tachypnea refers to rapid respiratory rate. Hyperpyrexia means increase in temperature. Arrhythmia means irregular heart rate. Which of the following actions should the nurse take to use a wide base support when assisting a client to get up in a chair? Option A. Bend at the waist and place arms under the client's arms and lift. Option B. Face the client, bend knees and place hands on client's forearm and lift. Option C. Spread his or her feet apart. Option D. Tighten his or her pelvic muscles. Right answer is Option B. Face the client, bend knees and place hands on client's forearm and lift. This is the proper way of supporting the client to get up in a chair that conforms to safety and proper body mechanics. A client had oral surgery following a motor vehicle accident. The nurse assessing the client finds the skin flushed and warm. Which of the following would be the best method to take the client's body temperature? Option A. Oral. Option B. Axillary. Option C. Arterial line. Option D. Rectal. Right answer is Option B. Axillary. Taking the temperature via the oral route is incorrect since the client had oral surgery. Choice arterial line and rectal are unnecessary. Taking the temperature via the axilla is the most appropriate route. A client who is unconscious needs frequent mouth care. When performing a mouth care, the best position of a client is Option A. Fowler's position. Option B. Side lying. Option C. Supine. Option D. Trendelenburg. Right answer is Option B. Side lying. An unconscious client is best placed on his side when doing oral care to prevent aspiration. A client is hospitalized for the first time. Which of the following actions ensure the safety of the client? Option A. Keep unnecessary furniture out of the way. Option B. Keep the lights on at all time. Option C. Keep side rails up at all time. Option D. Keep all equipment out of view. Right answer is Option C. Keep side rails up at all time. Although the other choices seem correct, they are not the best answer. A walk-in client enters into the clinic with a chief complaint of abdominal pain and diarrhea. The nurse takes the client's vital sign hereafter. What phase of nursing process is being implemented here by the nurse? Option A. Assessment. Option B. Diagnosis. Option C. Planning. Option D. Implementation. Right answer is Option A. Assessment. Assessment is the first phase of the nursing process where a nurse collects information about the client. Diagnosis is the formulation of the nursing diagnosis from the information collected during the assessment. In planning, the nurse sets achievable and measurable short and long-term goals. Implementation is where nursing care is given. It is best described as a systematic, rational method of planning and providing nursing care for individual, families, group and community. Option A. Assessment. Option B. Nursing process. Option C. Diagnosis. Option D. Implementation. Right answer is Option B. Nursing process. The statement describes the nursing process. The nursing process is the essential core of practice for the registered nurse to deliver holistic, patient-focused care. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.